wanted to turn to, everybody seemed that they had an experience with steroids. I know we were about to, get into potential treatments that you've used. I'm interested in your experiences with therapies like steroids or calcineurin inhibitors, or anything that are essentially repurposed therapies. They're used for something else that we've applied to FSGS. Shannon, you touched on the steroid resistance that your daughter experienced and some of the cosmetic but really important side effects that she experienced. Can you expand on steroids or other meds?
Sure. Steroids, it's interesting because it's very traumatizing, I think, for the most part, on anybody who takes such a high dose of steroid. Being a teenager in high school, a girl, certainly, I'm not taking away from anybody else, but just from my personal experience as a girl in high school, to have those stretch marks, and I have pictures of them that looks like she was mauled by a tiger. To look at these pictures, your heart will break to see that what her legs look like, all over her thighs, all over herself, and she still has them. They're just not real red anymore. They faded, but they're still there. That's a real tough thing to swallow for anybody, for a girl, with the body imaging and whatnot. But the steroids, it became such a traumatic thing for her mentally that when later on, one of the treatments that they had put her on, the LDL apheresis, Lipitor, she did the 9-week cycle of that, but they wanted to do the heavy blast of steroid. And I remember talking to the nephrologist because I was learning about this, and I talked to the pathologists from the New York Blood Center who were the ones that would come in and administer it. And I got a good understanding of what the treatment was. But when I specifically asked them, I said, I knew about this high dose steroid, and I can't recall at this moment whether it was a 500 milligram. It was a very, very high blast steroid that they used for this type of apheresis. And I said to him, what kind of data, what do you have that shows specifically people, is it a 70%, 80% of the people that have used the high dose? Where is it? And she said, well, there is no real definitive thing, whether if you use it or you don't use it. And that right there, I said, absolutely not. I refuse to put my daughter through that traumatic experience again. So that was one medication. We decided not to do the high dose. It did not work for her. The Lipitor, it didn't work for her. But I don't say it didn't work for her because she didn't do the high dose of steroid. It just wasn't the right treatment. And then again, they wanted her to try the Acnar medicine. And again, that would cause the steroid-like side effects. And I just refused. I said, I can't put my daughter through the mental. I'm very big with the mental part of this disease because I always feel the mental is equally as important as the physical part of this disease. So I refused, and knowing it was also a very small percentage that it would probably work for her, maybe 25% chance. I didn't want to put her through that steroid side effect because it just mentally wasn't the right thing. And that I used deep down in my mom gut, and also her. She said, nope, I don't want to do it. Unless you gave me 100% foolproof that this was going to do it. I said, I'm not willing to put her through that. So.
Yeah, wow. Jill, you also were nodding your head and when Shannon was talking. Can you relay some of your treatment experiences?
Yeah, so I've been put on high doses of prednisone multiple times through this journey. And I mean, in 8th grade, at the age of 14, I was put on high doses. I had the typical moon face, and I wouldn't go to school most days in 8th grade because I would be teased. I looked different, and that was hard to manage at that age. I too, Shannon, have horrible stretch marks from the weight gain from the prednisone. I had like 20 pounds of extra weight on me in 8th grade. And it didn't work. And I've tried prednisone many times. They would say I am steroid resistant at this point. I did try Acthar gel as well. And I will say that with each time that I've tried prednisone and then my last attempt with Acthar gel, the mental impact has been worse and worse. Um, I will never try prednisone again.
What
I
does
think
it do
not.
to you mentally?
I mean, I think the combination of insomnia, insatiable like hunger, irritability, the mood swings. I mean, I don't even feel like myself. I lose myself when I'm
Wow.
on prednisone. I'm no longer Jill. I feel like I'm the Incredible Hulk. And that's not fair to me or my family. And it doesn't work. It does not work. I think
Wow.
it's a nice attempt, and I think it's been used over and over and over again for people with FSGS, but it is not a good solution, in my opinion.
Wow.
I think there's a lot of long-term side effects that I believe I'm suffering from because of all the prednisone I've been on.
Sure. Dean?
I've been very fortunate that I've had to take prednisone, but I have not been on high doses of prednisone. Uh, Before I went on dialysis for the first time before my first transplant, that whole time when I was being watched to see if my kidneys were going to fail, they decided not to give me prednisone at all. I had different blood pressure medications to reduce the protein in my urine. I can't remember the names of them, right now. But now with my second transplant, I insisted on as low a dose of prednisone as I could possibly get away with. And for these past 11 years, I've been on 2.5 milligrams of prednisone. And when I listen to you, Shannon and Jill, I just realized it just makes me grateful that I haven't had to go through what your daughter, and I can only imagine, and what you had to go through, Jill. But even with that tiny, tiny amount, which they say is probably the reason, in addition to the anti-rejection meds, that I still have my kidney, it makes me anxious. I'm on anxiety medication because of the prednisone. Between the prednisone and the anti-rejection medications, I have repeated bouts of diarrhea, and they've switched me around with various medications, but I just have to, live with it. My stomach is always messed up. And I used to think, oh, maybe I just can't eat this or that anymore, but it doesn't matter. I never know when I'm going to have a really bad bout of digestive issues. I am probably, I complain a lot to my husband and to other people about, my face. But I hate being on Zoom, but when I try to be grateful for that I haven't had more issues with it. But what I don't like is when the doctors don't pay attention to your side effects. They say, oh, everybody has a little bit of prednisone in their body anyway, and you're only on this amount. So, don't worry about it. It's not an issue. You look fine. One doctor even said, it's just the normal aging process, the way your face looks. And, I wanted to kill him. But but they just, because they feel you should be grateful, to be alive, and not want to deal with. I just don't know in the long run what all of this medication is doing to me. But I just try to make the best of it.
And Kent, what's your experience like with treatment for FSGS?
It hasn't changed.
Mm.
There's been no monumental change in the field like there's been in diabetes, and like there's been in hypertension, and like there's been in heart disease. It doesn't exist. What exists is being placed, because there are no other alternatives, on 110 milligrams of prednisone and controlling like an ACE or an ARB for your blood pressure. And I've been on ACEs and ARBs for over 25 years, since their inception, because of my nephrologist who understood this whole concept of medication in transplant patients. But to undergo that, to suppress the illness, 110 milligrams over a 6 weeks course. And I can tell you what a person looks like, and I can tell you how they act. And if you really want to know, I can bring my wife in and she'll tell you all about it. She didn't like it one bit, and neither did I,
Wow.
because I thought I was going to die.
Mhm.
It was that simple, just going to die. But I stuck with it, because as the reduction went on, we got to the end. And, you know, when I was on 5 milligrams, I got to 5 milligrams and stayed on 5 milligrams, been there for 33 years. And I can tell you, had it not been for my nephrologist telling me, you know, I would just love to give you the magic pill. It doesn't exist. And I don't see it coming down the pike in your lifetime. But at least right now, you're stable. You've got a good career going, and I want you to stay with it. And if something comes up, you'll be the first to know, because I'll make sure of that. So that physician, that nephrologist, he's the gatekeeper.
Yeah.
Okay. He is the gatekeeper.
Sounds like you had a great experience with your
Yes,
nephrologist.
he's still practicing after 42 years. I still call him on the phone. I have no problem texting with him. And it's not about, well, how are you doing? It's always about, what are you doing? Because he knew if he hadn't done what he did with me, I wouldn't be where I'm at right now. I'm 71 years old. All right. And I'm glad of the treatment I received all the way through. And this man had given that kind of treatment to all of his patients. And unfortunately, the bad thing about it is some people don't progress, like they can't keep the transplant. You know, I am so grateful and humbled by the fact that I've had mine for a long time. And when I talk to people about it, they ask me, I don't bring it right up. If they ask me how long it is, I say, well, 30 some years, and they're shocked. Well, I just want to say that, give them some hope. I would have said that to Jill. My goodness, Jill, my heart goes out to you. Okay. I want the best for you. All right.
Appreciate that.
I
Thanks.
want the best for you. Okay. And I want the
Thanks.
best for you, Dean. And it's up to us to continue with that and keep people that have this disease that's very rare. I don't care. It doesn't sound like it's rare to us, but it's rare in the medical community.
Sure.
All right. And now I get it. I see progress in the last 2 years, and I am ecstatic. And I want to be part of that. I don't care. I'm 71 years old. What chance is it if my kidney does, just age out? What am I going to do? I have some end of life issues to start thinking about. All right. What are my alternatives if my kidney goes south? My brother's kidney goes south. What are my options? That's all I've ever asked, is give me some options, Doc. Just give me the options and let me make the decision. All right.
Yeah, those are very tough and important, questions that you all have to deal with
Absolutely.
on an everyday basis. I cut you off, Jill. So
Oh, I feel like I've tried every treatment that I've been eligible for. I mean, there's a lot of clinical trials I'm not eligible for being a transplant patient, but I've tried the prednisone, I've tried cyclosporin, I've tried rituximab. I've done many rounds of plasmapheresis, and now I'm on, I think, I don't know. I mean, I've probably done 60 LDL pheresis treatments, and I'm doing that ongoing. And the only hope really with those LDL treatments is that it's slowing down the progression of the disease. It doesn't seem to be treating it.
yeah.
I'm doing taking belatacept infusions now.
I was going to ask about that.
They did that to replace the tacrolimus because they felt the tacrolimus was becoming toxic to the kidney. And so now once a month I do belatacept infusions. So I feel like I've tried everything that's been offered to me with no success. And so I'm grateful for all of the treatments that are out there and that they clearly have probably helped other people. But it's scary because I feel like for me, the next option is dialysis, and dialysis isn't a great, I did dialysis and it was miserable. That's not a great quality of life. And I don't think it's a good solution. And so, yeah, I'm hopeful for the future. I'm hopeful to hear what Goldfinch is doing, and hopeful that more treatment options will be available that will maybe have less horrific side effects.
Sure.
We've been
no, I
hoping for
agree.
that for 50 years.
Well, you know,
Yeah.
one of the things that I think of too is that I know what the doctors told me was, okay, your choices are dialysis and transplant. Well, I mean, dialysis is better than death, but you know, transplant is presented like it's a panacea. And that's a problem that I have too, because once your kidneys go bad, that's an issue you have for the rest of your life now. Even if you get a transplant, you're always going to be dealing with one, that the transplant, your disease could come back, or the transplant could reject, or these medicines that you have to take forever that can become toxic. So I know we're going to get to the issue of the treatments that you want, but we definitely need something that intervenes in the process before the kidney gets so sick.
Yeah. No, most definitely. And it sounds like there is a dire need for treatments that prevent the progression, and not in a way that is toxic to the rest of the body either, right? There's a balance that needs to be met between, saving the kidneys, but impacting the rest of you.
Yeah.
And that's a very hard decision for everybody to make. And I understand why, Shannon, you said, no steroids for me, or for your daughter, I should say, because even though there may have been an opportunity to help, the data wasn't there, but you witnessed the side effects. So
Right.
it's
The mental, and she's on 5 milligrams for life, and she's okay with that because that's not giving her the moon face and the craziness that comes with wanting to eat everything, including the walls. It's and being on a low sodium diet, even to boot with that, is it's like, okay, you're on low sodium diet, but you want to eat everything around you. So yeah, the steroids, it just boggles my mind. Again, we've spoken about this, that I use the analogy about a computer being 75 years old and not being updated. And that's a fact, because that's what I feel about FSGS and treatments, how they could just, for all these years, going back, Ken, to you, and all these years ago, that nothing's changed. That to me is disturbing. It really is disturbing, and it makes me more makes me want to do more. I feel like I constantly have to do more, and that I'm not even doing enough. And just because it's just something that shouldn't be. There needs to be better options. There must be, and that's why we're all here fighting for this. And we are so thankful for Goldfinch to really push through this, lead the way to get us something.
It's your stories, and really you're the inspiration truly for us to hopefully make a difference in your lives or your family members' lives, and other patients that have FSGS and kidney disease. I'll turn to sort of other patients, and you've probably met other people with kidney disease as well. What do you tell them, given really what all of you have gone through? What do you tell them to be both realistic and hopeful? Kent, I'd be interested in your thoughts, because you've already provided some of that, but can you expand a little bit?
What's really heartbreaking to me sitting here right now, you talk about what pulls at your heartstrings. It's the fact that I got to spend 33 years with my brother's kidney so far. And these other folks, so why is it I get to? and others don't?
Mhm.
Why does it happen to be that 13 people die a day waiting for a kidney? And when I talk to new people that are diagnosed, and I really want to get them towards a transplant, I want to encourage them. I want them to, it's not, I understand it's not it's only a treatment just like dialysis or anything else, but it's the best. That's all that really is afforded to us. And it's the best option of all there is with FSGS at this point in time. There's been nights when I've woke up and I've wondered why I've been so blessed. And all I can say is that was intended. And now I spent my whole life, the rest of my life has been spent working directly with people with kidney disease. And my whole goal in life is to get them to that transplant scenario over dialysis. People I come in contact with, I want to make sure I get them the best option and the best choice that they can make. And hopefully it's transplant over dialysis.
Oh, definitely transplant is totally better. But to your question, I think it starts before you have trouble with your kidneys. People don't understand that kidney disease is silent and they don't know the risk factors. And I tell people, when you go to the doctor and they say, oh, your kidneys are fine, insist on knowing your numbers, insist on get that urinalysis. I want to know what that creatinine number is. What is it supposed to be? It's my blood pressure is 140. Is that really too high? Because, am I pre-diabetic? So that you don't get to the point where you are losing your kidneys, especially for African-American people where diabetes and high blood pressure and these issues are such big issues. I think that we have to just begin working with people before they get to the stage of having kidney disease. And then I think if you have it, then you have to be prepared to, like Shannon, you have to be prepared to advocate for yourself within the system in terms of
that's a given. Absolutely.
Who your doctor is going to be, what kind of treatment is out there, what is the best for me, and not just take whatever, there's not a lot, but just knowing and not being afraid to get emotional counseling and not being afraid to see a dietitian, but really fighting for your life once you're in the system.
Just give me options.
Wow.
That's all I ask.
So education, right? It sounds like education.
One of the things, I actually just met with a mom yesterday for a nice late breakfast who her son just recently had a transplant and FSGS recurred. And she thanked me for a few things. And one of the things she had said to me is about the dialysis, because I gave her, some insight about dialysis and also talked to her about what I did. Right from the very beginning, I got a journal. And me being me, I didn't just go to the store and get a journal. I had to research the best journal. I wanted the journal that fit my needs, meaning that I like to think of things in a positive way. I'm not one that I don't want people to feel sorry for me or, oh, woe is me type of thing. That's the way I was raised. So I like positive thoughts, positive affirmations. So I went and found a book that on each page, at the bottom of the page has a nice little positive saying. So this way, every day that I open that book, I can start off with something that's in a positive note. And from the very, very beginning of her being diagnosed, and I started that journal. So when we went through this whole 2 years process and then went into the hospital, we were in the hospital for 6 full weeks at New York Presbyterian Columbia over the summer for her transplant. 6 weeks. It was a lot. It got to the point, it was funny because they had put me on some of their rounds with them, the doctors. They could say anything to me and I'd be like, oh, okay. On February 11th, she was on 10 milligrams of Tacro, and I knew every last thing because I advocate. We're talking about Ken, when you said about those blood labs, literally, she would go get her blood labs. I would be there the very next day, right at that lab with my licensing.
Absolutely.
I want my daughter's, papers. And then they actually had somebody who wouldn't give it to me. I don't accept that. To me, I needed to know her labs immediately. And one of the things I tell people is to be educated. Don't go and Google things. You have to really trust in your team. And I say team
Absolutely.
because it takes a team of people that you work with, besides your nephrologist, your cardiologist, your nutritionist, your mental health workers. Everybody takes a team. And I always feel that, me as a mother of a child, I felt that, if I didn't trust my team of doctors 100%, I needed to walk away. I felt that they have my child's life in their hands. So I basically interviewed them in that way. And our doctor at New York Presbyterian, Dr. Jane, I love her so much because she's extremely passionate. She's feisty, she's sassy. She knows that when I get on the phone with her, that she's, she has to have her A game, because I'm not going to sit back and just, listen and say, okay, do this, do that. I want to be proactive and involved. And I encourage other newly diagnosed people is to really get their facts not from Google or Facebook groups, not to knock them. They're great for your needs, but you really have to listen to the professionals that this is what they do. This is what their job is. And if you're not comfortable, find somebody else. Like Ken, you have a wonderful team. My team, to me, I feel is the best. I'm very grateful for them. So that's what I always say. Get a journal, write everything down, get the best team that you can possibly have, and be proactive.
So you're gonna go in,
Education, trust, experience,
yes,
support, right?
Right.
yeah. If you're gonna go to a physician and place your trust in them, and you do, and decide not to do it, that's your choice.
Yeah.
But you have got to be able, as an individual, to make decisions. You can't make decisions on your own without good knowledge, and you don't get that off the internet.
But it sounds like your team earned your trust, Shannon.
Well, it did.
And
My team did, yeah. And I've had more than one in 30 years.
Yeah.
I've had several. I've had 5 nephrologists because they rotated through my small community.
Sure.
I've been blessed with the medical care that I've received, and it doesn't get that distribution throughout this country.
Correct.
That's the difficult part.
think
It's not lost on me that I live in a small community. It's not lost on me that it's just really hard for me to understand the lack of progress. And I think this is changing now. I want people to understand that in the last 2 years, 3 years, I see change. I haven't seen that in my whole life. Okay.
Jill, I'm curious about your experience as well with talking to other individuals, but maybe also what support you received too from others while you were going through the process.
Yeah. I think there's hope too. So living with chronic kidney disease hasn't stopped me from living life. I've gotten my master's degree. I've always worked. I'm married. I have a beautiful 6-year-old son. I'm very blessed. Living with kidney disease has just made doing some of the things that I've accomplished harder. But I haven't let it stop me. And that's because I have a very supportive family. I have a very supportive husband. And I can call on them and all my friends when I need a little extra help to get things done. And no one's ever said no. Everyone's very willing to help, and they understand. I live with chronic anemia, and so that makes you really tired.
Oh,
and
yeah.
so sometimes it feels like I'm walking through mud. And on those days, people rally around me. And so I've been very blessed to have a lot of support. And so when I meet other people with kidney disease, I try and encourage them with my life example, but just the fact that kidney disease doesn't define who you are as a person. It's just a part of who you are. It's a part of your story. And it's a part of the story I wish I didn't have, but it is. And so I too have had counseling to try and come to terms and acceptance with the fact that this is something I will deal with for my whole life. And but that it doesn't define me. And I think that's a really important piece.
Wow, that's incredible.
It is.
Very
It's
well
totally
said.
incredible.
Yeah.
Yep. The one thing that I speak to the patients about, that I work with, the people that I talk to that have kidney disease, is that you're a walking example of what Hollywood is like. No one knows what's going on inside of you. They think you're just fine. All right. I've had several people say, well, I wouldn't, if you had told me that I had a transplant, I wouldn't even know it.
Right.
The same thing comes to you. You know, when somebody says to you, you've got kidney disease, I'm proud to say, yes, I do. I've struggled with it for years. And when I have people that want to go out and look for a donor, I tell them, don't tell them you're okay, because you're not. You have kidney disease. Accept that fact and tell them what kidney disease is all. Educate them, because you're educating yourself when you do that.
Mm-hmm.
They can't pray for you, and they can't help you if they don't know what's going on inside of you, because it isn't going to show on the outside.